Hey guys, just a quick note about the video you're about to watch. So as you know, March is nationally recognized as Endometriosis Awareness Month, and typically in various cities and states across the world, different organizations and advocates, we come together and we put on marches and events and expos celebrating endometriosis and also educating and raising awareness. Well, this year, unfortunately, in light of everything happening with the COVID-19 crisis, all of our events were canceled. And so a lot of Endo sisters were feeling like a little left out and kind of cheated, like we didn't get a chance to do our thing this year. And so in light of that, Fighting Fiercely partnered with Endo Army and some amazing Endo peeps from literally all across the globe to put on what we called the Endo Weekender, which was an amazing online event with different presentations from nutritionists, endo specialists, advocates, and advocators literally from all across the globe. And Fighting Fiercely had the honor of participating in two presentations for that event, and the one that you are going to watch now I'm really excited about. It was a roundtable discussion that I call Sister to Sister, my experience as a Black woman with endometriosis, where myself along with fellow advocates Latia Lee and Krystle Bell-Saulsbery came together to discuss the unique challenges that we face specifically as Black women along this journey for endo. So I hope you enjoy it. Feel free to leave your thoughts and comments down below, and if you want to continue the discussion, let me know. We'd love to do a part two. Enjoy. Thank you so much for joining me today. My name is Michelle Johnson, and I am the founder of the Fighting Fiercely Endometriosis Awareness Movement and the author of Fighting Fiercely, Unveiling the Unknown About Endometriosis. And today I have Latia and Krystle with me, and we're going to be talking about Sister to Sister, our experiences as Black women journeying through endo. So before we jump in, I want to do a quick introduction of my guest today. First, we have Latia. She hails from New York City, right here in the U.S., and she was diagnosed with endometriosis in 2017 after 23 years of suffering. She currently is diagnosed with stage 4, deep infiltrating endo, and she's also diagnosed with diaphragmatic endo, which caused her to have 4 lung collapses. And I'm really excited to speak with you, Latia, because although diaphragmatic endo is not common, it's not one that we talk about when we have the conversation at large. And also with us, we have Krystle Bell-Saulsbery, and she is from Alabama. She has a lot going on. This sister is doing a lot. She is a pageant consultant, an author, a speaker, a content creator, an actress, model, and stage 4 endometriosis awareness advocate who has been fighting fiercely for 12 years. Thank you, ladies, for joining us today.
Thank you for having me.
So, a lot of you, I think we're in a lot of the same online endometriosis groups. And part of the reason that I wanted to engage in this discussion is because I'm not sure if you guys have experienced this, but a lot of times whenever I want to share information or articles with a specific focus on Black women in the endometriosis space, a lot of the pushback that I get is, well, why do you have to bring race into this? Why are you making this about race? We all suffer from, endo, and this disease doesn't discriminate. And while the disease may not discriminate, the people who we depend on for our treatment and our care, they may discriminate, and they may not even be aware that they're doing so. And so I thought that it was really important for women of color to get together and have that conversation to hopefully get not just the doctors to understand, but other women in the endo community to understand that we're not lessening their experiences. We just want to make them more aware of the specific additional hurdles that we face while going, by trying to live with this disease. So you have, ladies, can speak to any experiences that you have had in that social space with just trying to talk about being Black with endo?
Well, me personally, I have been booted out of 3 groups.
Oh, wow. Wow.
So I'm pretty sure the groups that you're talking about in particular, I'm no longer involved in because I was booted out. But yes, I think just in general for our population, women of color, just as a collectively, just not with endo, but just in healthcare in general, there definitely is a disparity, right? So we think of on average endometriosis diagnosis, it takes 7 to 11 years, right? And then on top of that, you add being a woman of color, where a lot of times our pain is dismissed. Like in my situation, it took 23 years.
Yeah.
So I'm also finding out for like women of color, it's taking us much longer to get that initial diagnosis and treatment.
Yes,
So
absolutely. Krystle, do you have anything to add to that?
Well, as far as the groups are concerned when it comes to Black women of endo, I haven't had any personal experience when it comes to me being African American, but I had experience being ridiculed for saying certain things in groups, because I'm of the mindset, of course, we're all going through pain and we have different experiences, but I try to leave things on a kind of positive light, and I was actually ridiculed for being positive, and not just by one person, several people. So I just politely took myself out the group because I didn't like that negative energy.
Yeah, and it's unfortunate when Black people, Black women come together and say this is the reason that we need safe spaces. A lot of times we are accused of reverse racism, and it's like, and it's not that, but it's just the fact of the matter is that being Black women in this country, especially as it relates to our experiences in healthcare, they are different. And to the point that you made, Latia, early on about, you know, the history in this country of just being treated differently in healthcare, I want to kind of dive in by referencing an article that I found. This comes from the Washington Post, and it was originally posted April 4th, 2016. And the title reads, "The Disturbing Reason Some African American Patients May Be Undertreated for Pain." And the article jumps right in the very first sentence, and it states, African Americans are routinely undertreated for their pain compared to whites. Very first sentence in the article. And it goes on to talk about a research that was done at the University of Virginia, where a group of medical students, white students, and residents were given all of these untrue statements, and the article describes them as sometimes fantastical differences about the races. And the whites tended to believe those statements. For example, they believed that Black people had less sensitive nerve endings than white people. They also believed that Black people's blood coagulated more quickly than white people's. And for all of those types of biased statements, at least half of the students thought that those statements were possibly, probably, or definitely true. And it goes on to talk about how because of those beliefs, they often rated Black patients' pain as lower than white patients, and as a result, they gave less appropriate recommendations for how they should be treated. And it even talks out, it made a point that 74% of white patients with the same ailments, such as bone fractures, received medication versus 50% of Blacks, and that most doctors underestimate the pain level of Black patients compared to other patients. Have you guys ever experienced anything like that in your journey with endo, not having your pain relieved or being told that your pain, you know, is being exaggerated?
I'll share this. I actually started having what I believe to be the symptoms of endo around the time I was 12, 13. So it got to a point it was getting worse, and my mom took me to a gynecologist at the time. I think I was 13 years old. And I vaguely remember the doctor telling my mom, oh, it's okay, just give her some pain medication. So not really being heard and not really being taken seriously to show that doctors like, this is more than just regular menstrual cramps. This is something beyond that, and not really being taken seriously. And also just talk about even something even deeper, when they were trying to figure out what was wrong with me, he was giving me a pelvic exam and not really explaining to me what that entailed. And just being not the most sensitive and not being the most not only sensitive, but just having that nice bedside manner and just not really explaining to me what happened. Honestly, it was a traumatic experience for me at 13 years old, to the point where I didn't want to go to another gynecologist. Now, of course I did, but it was always a traumatic experience even going, because at age 13, I remember the experience not being a pleasant experience at all. It was very traumatic for me, and not being explained to me what was about to happen.
And I can relate to you, Krystle, as well, because just thinking about, like you said, just normal routine gynecological exams, just kind of being rough and just kind of like just jamming the instruments, you know, into your body without any forewarning. And if you do, you know, scream or express pain, it's like, oh, calm down. It's not that bad. And it's like, no, I was not prepared for that. So I can definitely relate to your experience. Latia, anything to add in that realm?
I think I started having really bad, severe menstrual cramps around 13 and a half, 14. And I do remember my mom taking me to the gynecologist. And of course, the first thing they prescribe is birth control, right? That's the first thing I got on. Off and on, but, you know, still, despite with the birth control and like taking the Tylenol and Advil, nothing really seemed to help. And I went to a nurse practitioner for most of, 15 years plus. I mean, she was very pleasant, very nice, wonderful bedside manner, but I kept telling her that my pain was getting worse and worse. I never was offered any type of opiates whatsoever. It was just, try, naproxen, Advil, Tylenol. Nothing helped till it got to the point, and I would get new symptoms, and she'd be like, oh, it's just the position of your uterus. Like, endometriosis was never brought up, to the point where I just stopped asking and learn how to deal with the pain. Because I felt like, well, if I'm going to my nurse, my healthcare provider, I'm telling them I'm telling them what my pain is, they're not doing anything about it. I honestly thought it was just something that I had to deal with. And we'll dig a little bit deeper into what actually brought my diagnosis, which was my collapsed lungs.
Wow.
Cycles. Wow. So if I didn't have them, I honestly think I still would
not be diagnosed. Wow. And it's funny that both of you point to, pain insensitivity, because the next piece in the article talks about, in that same study we referenced before with the white residents, that 58% of the people in that group believe that Black skin was literally thicker than white skin. So if you are, and again, this was about 40% of first and second year students, but 25% of residents, meaning doctors who were already in practice and being trained in specialties, right? And because of these biases, it said that doctors who showed these biases were less accurate in their treatment recommendations, right? So it was fair to reason. If you think that Black people literally don't feel as much pain, why would you give them a stronger medication? Why would you look into more deeper testing to see what the cause of their pain is? You think that we literally don't feel pain the way that white people do. And that is still persisting today. And so moving into a second article from the Washington Post, and this was posted in July, of 2019. And this one speaks particularly to us, stating that it is common, particularly for women with pelvic and menstrual pain caused by conditions such as endometriosis and fibroids, to be told their pain is just a normal part of being a woman, which both you, Latia, and Krystle mentioned. And in further studies in 2012, which was a culmination of 20 years of research, stated that here in the United States, African American patients reporting pain were 22% less likely than white patients to even get medications from their doctors. And the reason being, and Latia, you alluded to this, is that because some healthcare workers falsely believe that patients of color are more likely to abuse prescription painkillers. And this was shocking to me, that in an additional study, which was done nationwide, 72% of white doctors underestimated the pain level of minority patients. Right? So that goes back to your point, Latia, about opioids were never even brought into the discussion.
Mhm.
They were never even brought into the discussion. And I know that for me, with my pain, I had gotten to a point where opiates were the only thing that barely touched the pain. And even then, it still did not control it. But yet, doctors were hesitant to increase the dosage, and they would cite things like, oh, well, you have a family history, but my history does not dictate any tendency or propensity toward abuse. Krystle, have you had any experience with regard to, facing resistance when you were trying to get opiates or other types of prescription drugs to help manage your pain?
Yes, initially, when I was first going to the doctor to see what was going on, they didn't prescribe me anything. They just told my mom to give her something over the counter, whether it be Tylenol, Advil, and of course, I tried everything under the sun, and it did not work.
Mm-hmm.
It wasn't until probably when I guess maybe my 20s, early 20s, when I was prescribed something a little stronger, but it took, like I said, several years for that to happen. And even going back to what Latia said about birth control, I remember when I went and saw a nurse practitioner, this was a separate healthcare professional, and I was telling her the same thing that I told the first doctor, and that was the first thing she immediately decided, let's give her birth control.
Mm-hmm.
And so, they don't talk about opiates. It's just like, let's just give her birth control. Maybe that'll help. So it worked for a little while, but
for a little while.
Of course, the pain never went away.
Yeah, and that tends to be like it'll manage it and that's the thing. Our bodies, and this is my experiences, and you ladies can feel free to chime in. But I found that if I did find a medication and it worked, it would work for a while, but eventually my body would adapt and I would hit a wall of resistance and it wouldn't work anymore. And so I would have to be dosed up and up and up. Mm-hmm. And some doctors, think that you're just, what is the word? Seeking pain, or drug seeker, I think is the term that they use. And it's interesting to note here that it indicates in research that some of the disparities in the pain treatment are because of implicit or unconscious biases that are amplified in the medical system. And it says here that because overloaded healthcare providers only have a little time, very little time to spend with their patients, that they may resort to falling back on stereotypes when making clinical decisions. And that is really a scary thought. And with respect to us with endometriosis, it says that a lot of these disparities in studies were done revolving around acute pain, right? But it says that risk of falling back on stereotypes and biases is even greater when it comes to chronic pain, which, hello, that's our category. Endometriosis is a chronic disease. And so if you have a disease that's always with you, you have pain that's always with you, what else are you going to do but continue to seek pain management options? Not necessarily drugs, but something to alleviate the pain. Can you, either of you ladies, speak to
that? Yeah, I mean, I got to the point, what happened to me was in 2016, I had a lung collapse. And I was on the second day of my cycle, and I was like, well, this is horrible. You have a lung collapse and you have pain from endometriosis. And, I ended up having to have surgery, a lung resection, and they just said, oh, it's a spontaneous. But the crazy thing about it was in the ER, the attending said, you don't fit the typical description criteria of someone to throw a spontaneous a pneumothorax. You just don't. Mm-hmm. But she didn't dig a little deeper. Like if she had asked me, like, do I suffer from really bad menstrual cramps? Like that could have maybe prompted a little bit further in like investigation in that.
Put two and two together. Yeah.
Mm-hmm.
Yeah. And it's interesting that you mentioned the fact that she said you don't fit the typical protocol. Mm-hmm. Because moving into now our third article here, which comes from BJOG, an International Journal of Obstetrics and Gynecology. This was also published in April of 2019. And it says here that endometriosis has historically been described as a disease of affluent, high-achieving women with private health insurance who have delayed childbearing. And because of those biases, it has often been stated that the disease is entirely uncommon in Black women. But what that study also suggests is that there's not the difference, it's that the pelvic pain in Black women were misdiagnosed. So what you're saying here, even with your case of it being, thoracic, still not taking the time to dig deeper and ask those additional questions, like you said, that may have, made things click and allow for her to put two and two together, to maybe help you get that diagnosis a little bit sooner.
Yeah.
The last article that I want to touch on, gosh, we're about 20 minutes in already. Can you believe it? My goodness. But this article, this last one, really, really resonated with me. And this one comes from Endometriosis News, published in February of 2019. And this one struck a nerve with me, ladies. And again, talking about that notion of endometriosis being a disease that affluent white women suffer from, right? There was so that notion was still persisting, first in 1941 and then in 1951. But then something happened in 1976. There was a Black gynecologist by the name of Donald Chapman who performed his own research study, and he noted that even though 1 in 5 of his patients in his private practice, these were not like county or public or ward patients, they were private patients, they had signs of endometriosis, but 40% of those women were misdiagnosed with pelvic inflammatory disease, arguing or perpetuating the myth that Black women were more promiscuous. And that hit a nerve with me because I personally experienced that. After maybe about a year and a half or so after my initial diagnosis and my first surgery, my symptoms came back and they were persisting. And so on the recommendation of some other endo sisters, I went to see this doctor who was touted as being like this incredible, specialist. And in describing my symptoms to him, one of the things he kept coming back to was not asking me if I was even sexually active, but how many partners did I have? Even though I was expressly stating to him, I'm abstinent during this time. I don't have any sexual partners, but the conversation kept circling back to like, well, how active have you been? How many, and he kept trying to push this narrative about this pelvic inflammatory disease. And I'm like, that is not what is happening to me. So when I read that really struck a nerve with me, because I know that is something personally that I have dealt with. When you talk about pelvic pain, the first thing they go to is STDs. Could you be pregnant? Could you have an STD? Have you ladies ever gone through anything like that?
I personally have not. I was very fortunate that through the symptoms of having endometriosis, I self-diagnosed myself by researching, and the first specialist that I saw was actually an excision specialist. So
that's awesome.
So when I went to see him, he really listened to me and validated my feelings. And, I saw him in November of 16, and I was very lucky. By February of 17th, I had my first surgery.
That is awesome. That is great. Krystle, what about you?
I haven't had that experience as well. I will say my story is kind of similar to hers. Is when I finally was officially diagnosed, I met with a specialist that really chose to hear me out, understand my symptoms, and he wanted to get to the bottom of it. So I really didn't experience any, stereotypes in that manner. So which is a blessing.
Well, I think, yeah, go ahead.
I think that's why it's so important, and why we advocate that, women who have symptoms of endometriosis are diagnosed or think they do, they really need to see an excision specialist first. Because they know, they validate our feelings, they know the treatment that we need. They'll give us, the proper testing that we need to kind of, for them to navigate and collaborate with other specialties if they need to, during their surgeries. There's a difference between, how some women feel they're being dismissed and mistreated, with a regular healthcare provider versus an excision specialist.
And I think that you guys, you were very blessed. For me, my experience was a little bit different. I did have to go through several doctors before I found one that heard me and that listened to me and that didn't objectify me or stereotype me. And I think that just speaks to kind of like that window there, that 7 to 12-year window of being accurately diagnosed, which for many women of color can tack on even a few more years to that. And so before we wrap up, ladies, we're down to our last 10 minutes. And I just want to end by one of the articles that I read, I think sums up everything that we've been discussing today in a very appropriate manner. I thank you, ladies. I think that we have done a great job in perhaps bringing awareness to those in the medical communities, or perhaps other ladies with endo who may not necessarily understand the differences as to why we feel that we need to have this particular conversation as it relates to white women. But in one of the articles, the doctor made a statement saying that awareness alone will not solve the problem, and neither will one-off empathy training sessions. She says a lot of things need to change simultaneously for this deeply ingrained culture to change. And with that being said, if you ladies could give me, if there was one thing that you would want to say to any doctors or medical professionals that may be watching this presentation, that you would want them to know as a Black woman going through this journey, what piece of advice or commentary would you leave to them to get them to ponder or think about or to implement, so that facing this journey as a Black woman, we don't have to deal with that added burden of having to consider race as well when we're trying to manage this disease?
I guess my piece of advice would be to know that every woman is different. It doesn't matter her age, her race, or what have you, whether she's sexually active or not. We all have different experiences when it comes to this disease. And it's not a one-size-fits-all disease. And I think doctors need to understand that, and to know that we're all different and we all need to be heard and we all need to be treated accordingly.
Latia?
I think the key for me, if I could tell a healthcare provider, is to honestly take the time to really listen to us. I was very fortunate to be able to interview a neurophysiologist called Mark Passover. And he said that you could learn so much about your patient if you actually take the time to listen to them and do a full assessment, like really listen to their symptoms, and be compassionate. You know, this disease for us is hard. You know, we struggle. We have days where like it's just hard just to get up. And then we honestly just want to be heard. We want to be listened to and not dismissed. You know?
Thank you. And I think my note would be to show a little empathy, to place yourself in the other person's shoes. If that person sitting on your table were not Black or were not some other minority, if that was your daughter or your sister or your mother sitting in there, would that change the way that you were treating that patient? You know, and if it would, then maybe pause and take a step back for a little bit of self-reflection, and learn to integrate whatever those treatment practices that you would do for your own. Your patients are just as important, and we deserve that same level of care, that same standard of care, that same attention to care.
Exactly. Yeah.
Absolutely.
And with that, ladies, we have reached the end of our forum. I want to thank you guys so much for joining us today. Thank you, Latia and Krystle. Your input has been so invaluable, and hopefully, you know, the right eyes will get on this, and, you know, we will educate, enlighten, and empower some people to think differently, perceive things differently, but more importantly, to act differently. And Latia, I know you and Krystle as well do advocacy. So really quickly, I'm sorry, I drew a blank. Sorry. Any social media platforms or websites or things that you want to share in case someone wants to follow you or learn any more about your advocacy?
My IG name is Fearlessly Defying Endo. I am actively involved in the Endometriosis Foundation of America. I'm actually one of the junior board members. But unfortunately, due to COVID-19, everything has kind of been pushed to the side. But you can check out my Instagram, and I hope to, once we can start mingling with each other, have another meetup. And once Patient Day is back, hopefully in September, we're aiming for. I'm actually one of the speakers and actually on the patient care committee. So I definitely will be just sharing that information as we have a date when it's going to be rescheduled.
Okay, and Krystle, anything you have going on in your advocacy efforts?
Absolutely. For those of you who want to follow me, they can find me on Facebook and Instagram at Crystal Clear Pageantry. Of course, I am a pageant consultant, and I'm also a contestant, and Endometriosis Awareness is my pageant platform. It's entitled Code Yellow, an alert on endometriosis. So they can follow me on those platforms, because I'll be sharing things, of course, pageantry, but of course, endo as well, since it is my pageant platform. And I'm also participating in the Black Girls Run Endometriosis Awareness Virtual Run this month. So I'll be posting pictures of that. So I'm very excited about that as well.
Awesome. Well, I will be sure to follow you ladies so that I can keep up with all the amazing things that you ladies have going on. And of course, I am Miss Fighting Fiercely. Again, Michelle Johnson, the author of Fighting Fiercely, Unveiling the Unknown About Endometriosis. You guys can follow me on Instagram at Fight Fierce Endo, and you can also follow me on Facebook at facebook.com/Fighting Fiercely, and you can check either of those platforms to see the remaining events that I have going on. I have 2 or 3 more virtual events going on to wrap up Endometriosis Awareness Month. So thank you ladies so much for joining us. We are out of time. Thank you so very much, and until next time, be educated, be enlightened, be empowered.